Most pediatricians will tell you to put your grandchild on their back to sleep. And while that's correct, what they don't tell you is that the position of their head during those 8 to 12 hours of sleep is silently reshaping their skull, compressing their airways, and setting them up for breathing problems, learning disabilities, and facial deformities that will follow them into adulthood. I've spent 42 years studying developmental psychology and pediatric sleep patterns, and what I'm about to share with you contradicts what you'll hear from 90% of childcare books, but it's backed by craniofacial research that's been published in journals like the International Journal of Pediatric Otolaryngology and the American Journal of Orthodontics and Dentofacial Orthopedics. The problem isn't just that babies sleep on their backs. The problem is that we've forgotten how to position them correctly once they're on their backs. And this oversight is creating a generation of children with flattened skulls, narrow dental arches, and obstructed airways. Let me explain exactly what happens inside your grandchild's skull when they sleep in the same position night after night. A newborn's skull consists of several bone plates that haven't fused together yet. These plates are separated by fibrous joints called sutures, and they're designed to be malleable because the baby needs to fit through the birth canal and because the brain is going to triple in size during the first year of life. When constant pressure is applied to one area of this soft skull for hours every single night, the bones respond by flattening in that exact spot. This isn't just cosmetic. When the back or side of the skull flattens, it creates a cascade of developmental problems that most grandparents and even many pediatricians don't connect to sleep position. The flattening forces other parts of the skull to compensate and bulge outward. More critically, it can affect the shape of the cranial base, which is the floor of the skull where it meets the spine. Studies published in the European Journal of Orthodontics have shown that changes in cranial base flexion directly impact the size and position of the upper airway. When a baby develops positional plagiocephaly, that's the medical term for skull flattening, the posterior part of the skull becomes flattened, which causes the cranial base to flex forward. This forward flexion reduces the space available for the nasopharynx, which is the upper part of the throat behind the nose. A restricted nasopharynx means your grandchild has less room for air to flow when they breathe through their nose, and this is where the problems begin to multiply. Humans are obligate nasal breathers, especially infants. Babies are designed to breathe through their noses, not their mouths, because nasal breathing filters air, humidifies it, warms it, and most importantly, produces nitric oxide, which is essential for oxygen absorption in the lungs. When the nasopharynx is compressed due to skull flattening, babies compensate by breathing through their mouths. Mouth breathing seems harmless, but it fundamentally alters craniofacial development. Dr. John Mew, an orthodontist who spent decades studying facial growth, demonstrated that mouth breathing causes the tongue to drop down and forward in the mouth instead of resting against the palate where it belongs. The tongue is supposed to apply gentle, constant pressure against the roof of the mouth, and this pressure is what guides the maxilla, your upper jaw, to grow forward and wide. When a child breathes through their mouth, the tongue sits low. The maxilla doesn't receive that guiding pressure, and it grows narrow and recessed instead of broad and forward. A narrow maxilla means a narrow dental arch, which means crowded teeth, which means a higher likelihood your grandchild will need braces, extractions, and possibly even jaw surgery later in life. But the cosmetic issues are actually the least concerning part of this equation. A recessed maxilla also means a smaller nasal cavity and a more restricted airway. As the child grows, this anatomical restriction increases their risk for sleep-disordered breathing, which includes snoring, upper airway resistance syndrome, and obstructive sleep apnea. Research published in the journal Sleep Medicine has established clear links between childhood sleep-disordered breathing and attention deficit disorders, behavioral problems, poor academic performance, and even cardiovascular issues. A study from the Albert Einstein College of Medicine followed over 11,000 children and found that those with sleep-disordered breathing were 40% more likely to develop behavioral problems by age 7. The reason is straightforward. Disrupted sleep means disrupted brain development. During deep sleep, the brain consolidates memories, processes emotions, and clears out metabolic waste through the glymphatic system. When a child's sleep is fragmented by breathing difficulties, even subtle ones, their cognitive and emotional development suffers. I'm going to show you exactly how to prevent this cascade. But first, you need to understand one more critical piece of the puzzle, and it has to do with the relationship between head position and the atlas vertebra. The atlas is the first cervical vertebra, the bone at the very top of your spine that your skull sits on. It's named after the Greek Titan who held up the sky because it holds up your head. The position of the atlas relative to the skull has a direct impact on the tension in the muscles and fascia of the neck and jaw. When a baby's head is turned to the same side night after night, or when their head is allowed to remain in extreme flexion or extension, the muscles on one side of the neck become chronically shortened while the muscles on the other side become overstretched. This creates an imbalance in the fascial system, which is the connective tissue web that links everything in the body. Fascial restrictions in the neck can pull on the temporal bones of the skull, which can affect the position of the jaw and the function of the temporomandibular joint. This might sound like I'm stretching the connection, but studies in craniosacral therapy and myofascial release have documented these relationships extensively. More immediately concerning is that chronic neck tension in infants can contribute to torticollis, a condition where the baby's head is tilted to one side and they have difficulty turning it the other way. Torticollis affects roughly 16% of infants according to data from pediatric physical therapy clinics. And while it's treatable, it's also preventable if you know how to position your grandchild's head during sleep. Now here's what almost no one talks about, but what I'm going to reveal to you in just a moment. The solution isn't to avoid back sleeping. Back sleeping is still the safest position to reduce the risk of sudden infant death syndrome. The solution is to understand how to position your grandchild's head while they're on their back and how to create variation so that no single area of the skull receives constant pressure. But before I give you the specific technique, you need to know about one more thing that most grandparents accidentally do that makes the problem worse, and it has to do with baby containers. Car seats, bouncy seats, swings, and those curved loungers that are marketed for infants all position the baby's head in flexion, meaning the chin is closer to the chest. When babies spend hours each day in these containers, in addition to sleeping on their backs at night, their heads are in the same flexed position for the majority of the 24-hour cycle. Research from physical therapists who specialize in infant development indicates that babies today spend an average of 5 to 6 hours per day in containers. Add 8 to 12 hours of sleep, much of it with the head in a similar position, and you're looking at a baby who spends up to 18 hours a day with their skull in a position that promotes flattening and airway restriction. The American Academy of Pediatrics has started to recommend minimizing time in containers, but they don't go far enough in explaining why. The flexed head position not only increases pressure on the back of the skull, but also reduces the space in the airway even further. Think of it this way. When you tuck your chin toward your chest, you're compressing the front of your neck and reducing the diameter of your trachea and pharynx. Babies experience the same compression, but their airways are already so much smaller that even a slight reduction can have significant effects on breathing efficiency and oxygen saturation during sleep. Here's the technique that changed everything for the families I've worked with over the past 4 decades. When you put your grandchild down to sleep on their back, you're going to pay attention to head rotation. Instead of allowing the head to always turn to the same side, which is what babies naturally do because they develop a preference based on how they were positioned in the womb and how they're held during feeding, you're going to actively encourage rotation to alternate sides. Here's how you do it. Position the crib or bassinet so that the interesting stimuli in the room, like a window, a nightlight, or a mobile, are on alternating sides each week. Babies naturally turn their heads toward interesting visual or auditory stimuli, so if the window is on the right side of the crib, the baby will tend to look right. After 1 week, rotate the crib 180 degrees, or move it so the window is now on the left side. The baby will turn left. This simple rotation ensures that pressure is distributed across both sides of the skull rather than concentrated on one side. If you can't move the crib, move the stimuli, hang the mobile on the right side for a week, then move it to the left side. But that's only half of the solution. The other half involves tummy time and side-lying time when your grandchild is awake and supervised. Tummy time isn't just for building neck and shoulder strength, although that's important. Tummy time removes all pressure from the back and sides of the skull and allows the bones to reshape naturally. The problem is that most grandparents and parents don't do nearly enough tummy time because babies often fuss when they're on their stomachs, especially in the early weeks when their neck muscles are still weak. The recommendation from pediatric physical therapists is to start tummy time from day 1 for just a few minutes at a time, several times per day, and gradually increase the duration as the baby gets stronger. By 3 months, your grandchild should be getting at least 60 to 90 minutes of tummy time spread throughout the day. That might sound like a lot, but remember, it doesn't have to be all at once. 5 minutes here, 10 minutes there, and it adds up. You can make tummy time more enjoyable by getting down on the floor with your grandchild, placing toys just out of reach to encourage them to lift their head and eventually push up, or doing tummy time on your chest where they can see your face and hear your heartbeat. Side lying time is equally important but often overlooked. When your grandchild is awake and supervised, position them on their side with a rolled towel or small blanket behind their back to keep them stable. Alternate which side they lie on throughout the day. Side lying takes pressure off the back of the head entirely and gives a different part of the skull a break. It also encourages the baby to practice turning their head both directions and helps prevent the fascial imbalances I mentioned earlier. Now let me tell you about the pillow mistake that's causing problems in thousands of nurseries right now. Some parents and grandparents, recognizing that their baby's head is flattening, purchase special pillows with a divot or a hole in the center designed to relieve pressure on the flat spot. The American Academy of Pediatrics explicitly advises against using any pillows, cushioned sleep positioners, or wedges in the crib for infants under 12 months because they increase the risk of suffocation. These products are not safe, no matter how much the marketing claims otherwise. The solution is not to add things to the crib. The solution is to reduce the total time the baby spends with their head on any surface, period, and to vary the position when they are lying down. Let me share with you what happens when you don't address this early. I worked with a family several years ago whose grandson, I'll call him Michael, developed severe plagiocephaly by 4 months of age. The back right side of his skull was visibly flattened, and his right ear was pushed forward compared to his left ear. His parents took him to a pediatrician who recommended a cranial remolding helmet, which is a custom-fitted helmet the baby wears 23 hours a day for several months to reshape the skull. These helmets cost anywhere from $2,000 to $4,000 and aren't always covered by insurance. Michael wore the helmet for 5 months, and while it did improve the shape of his skull, the family later discovered that he had developed a narrow dental arch and chronic mouth breathing by the time he was 4 years old. His parents didn't connect the dots between his early head flattening and his later airway issues until I explained the developmental cascade to them. Michael is now 8 and in orthodontic treatment to expand his maxilla, but this could have been prevented entirely if his grandparents and parents had known how to position his head properly during infancy. Write a comment below and tell me where you're watching from, because I want to know how widespread this issue is and whether pediatricians in your area are talking about positional head shaping. I suspect most of you are hearing about this for the first time, and that needs to change. Here's another critical factor: feeding position. Whether your grandchild is breastfed or bottle-fed, the position they're held in during feeding affects skull development. Many grandparents fall into the habit of always holding the baby in the same arm during feeding. If you always hold the baby in your left arm, their head is always turned to the right. Over weeks and months, this contributes to asymmetrical head shaping. The solution is to alternate arms with every feeding, or at minimum, with every other feeding. If you're bottle feeding, this is easy to implement. If your grandchild is breastfed and you're occasionally giving a bottle, make sure you're switching arms. Also, avoid propping a bottle and letting the baby feed in the same reclined position every time. Hold the baby in a more upright position during feeding, which not only reduces ear infection risk by preventing milk from flowing back into the eustachian tubes, but also varies the position of their head relative to their body. Let's talk about what happens in the maxillofacial complex when everything develops correctly versus when skull flattening and mouth breathing alter the trajectory. The maxillofacial complex includes the bones of the face, jaws, and skull base. Proper development depends on balance between genetic factors and environmental forces, with environmental forces being far more influential than most people realize. Dr. Weston Price, a dentist who studied indigenous populations around the world in the early 20th century, documented that populations who maintained traditional diets and lifestyles had broad dental arches, well-aligned teeth, and virtually no malocclusion, which means bad bites. When these same populations adopted Western diets and lifestyles, their children began to develop narrow faces, crowded teeth, and airway problems within just 1 generation. Price's work has been criticized by some modern researchers, but his core observation has been replicated in multiple populations. Environmental factors during development have a profound impact on craniofacial structure. One of those environmental factors is how and where the tongue rests during the thousands of hours of infancy and childhood. The tongue is a powerful muscle, and when it rests against the palate with the lips sealed and the child breathing through their nose, it exerts approximately 1 to 2 grams of pressure per square centimeter on the maxilla. That doesn't sound like much, but over months and years, that gentle, constant pressure guides the maxilla to grow horizontally and transversely, creating a wide dental arch and a large nasal cavity. When the tongue rests low in the mouth because the child is mouth-breathing, that pressure disappears. Not only does the maxilla not grow forward, but the cheeks and lips which exert inward pressure on the teeth, now act unopposed. The result is a narrow, vaulted palate and a dental arch that doesn't have room for all the teeth. Meanwhile, the mandible, the lower jaw, which is supposed to follow the growth of the maxilla, often ends up positioned further back because the maxilla isn't providing the proper forward reference point. A retruded mandible means the tongue, which is attached to the mandible, sits further back in the throat, which further compromises the airway. This is the vicious cycle of craniofacial underdevelopment, and it starts with something as seemingly innocent as how a baby's head is positioned during sleep. I want you to understand that I'm not fear-mongering here. Most babies who spend time on their backs will not develop severe plagiocephaly or major airway issues, but a significant percentage will develop mild to moderate flattening, and an even larger percentage will develop suboptimal craniofacial development that manifests as crooked teeth, narrow faces, and breathing problems that parents attribute to allergies or genetics, when in fact, the root cause was environmental and preventable. A study published in Pediatrics in 2013 found that 47% of infants had some degree of positional plagiocephaly. That's nearly half of all babies. While many of these cases are mild, and the skull rounds out to some degree as the child grows and spends more time upright, research using three-dimensional imaging has shown that asymmetries often persist into childhood, and that these asymmetries correlate with dental and orthodontic problems later on. Here's what I want you to do. Starting tonight, if you have a grandchild under 12 months old sleeping in your home, or if you're advising your children on how to care for your grandchild, first, assess the current sleeping environment. Look at where the crib is positioned relative to windows, doors, and light sources. Is there a clear directional bias that would cause the baby to always turn their head the same way? If yes, change it. Rotate the crib or move the visual stimuli. Second, implement a feeding arm rotation schedule. If you're doing regular feedings, alternate which arm you hold the baby in. Third, dramatically increase awake tummy time and side-lying time. Set a goal of at least 60 minutes of tummy time per day by 3 months of age, broken into multiple sessions. Fourth, minimize time in containers. This is hard because car seats are necessary for travel, and swings can be a sanity saver for exhausted caregivers. But try to limit discretionary container time. If the baby falls asleep in the car seat during a drive, that's fine. But don't leave them in the car seat once you're home. Transfer them to a flat surface. Fifth, examine the back and sides of your grandchild's head regularly. Run your hand over their skull and feel for flat spots or asymmetry. If you notice significant flattening or if one ear is noticeably forward compared to the other, bring it up with the pediatrician immediately. Early intervention, which usually means aggressive repositioning and physical therapy, is far more effective than waiting and hoping it will resolve on its own. Let me address the question I know some of you are thinking. What about those expensive bassinets and sleep systems that claim to prevent flat head syndrome? Some of these products are tilted or have slight inclines. Here's the truth. Any incline in a sleep surface increases the risk of the baby sliding down into a position where their airway can become obstructed. The safest sleep surface is completely flat and firm. Some bassinets have breathable mesh sides and mattresses with different firmness zones, and while these features can be fine, they don't replace the need for active repositioning and tummy time. There's no product you can buy that will do the work for you. The work is in how you position your grandchild throughout the 24-hour day, both during sleep and during wake times. Now I'm going to tell you about the connection between skull shape and vision that almost no one discusses. The orbits, which are the bony sockets that hold the eyes, are part of the facial skeleton and can be affected by asymmetrical skull growth. When one side of the skull is flattened, it can cause the orbit on that side to be slightly displaced, which can affect eye alignment. Strabismus, which is misalignment of the eyes, occurs in about 4% of children, and while most cases are due to muscle or nerve issues, some cases have a structural component related to orbital asymmetry. Additionally, torticollis, which I mentioned earlier, often co-occurs with plagiocephaly, and torticollis can limit the baby's ability to turn their head and track objects visually, which can delay visual development. The good news is that all of these issues are preventable or correctable if caught early. The bad news is that many families don't catch them until the problems are entrenched. Let me give you a clear action plan that you can follow week by week. For newborns to 8 weeks, focus on establishing a rotation pattern. Alternate which side of the crib has visual interest every 3 to 4 days. Start tummy time from day 1, even if it's just 2 to 3 minutes after each diaper change. Hold the baby in different positions throughout the day, not just during feeding. From 8 weeks to 4 months, increase tummy time to at least 30 minutes per day, working up to 60 minutes. Introduce side-lying play during wake times. Continue rotating head position during sleep. At this stage, you should start to see your grandchild pushing up on their forearms during tummy time and turning their head both directions easily. If you notice any stiffness or preference, mention it to the pediatrician. From 4 to 8 months, your grandchild should be spending progressively more time off their back as they learn to roll, sit, and eventually crawl. Continue supervised tummy time and begin encouraging sitting, which takes all pressure off the skull. By 8 months, most babies are mobile enough that positional skull flattening is no longer a significant risk because they're moving constantly and changing positions on their own. Let's talk about what to do if you're watching this and your grandchild already has noticeable skull flattening. First, don't panic. The skull continues to grow and remodel throughout infancy and into early childhood. The earlier you intervene, the better. But even if your grandchild is 6 or 8 months old, you can still make a difference. Implement all the repositioning strategies I've described with even more diligence. Ask the pediatrician for a referral to a pediatric physical therapist who can assess your grandchild's range of motion, muscle tone, and positioning habits. Physical therapists can provide exercises and stretches that help correct asymmetries. In moderate to severe cases, the pediatrician may refer you to a specialist who can evaluate whether a cranial remolding helmet is appropriate. These helmets are most effective when started between 4 and 6 months of age, and they work by providing a space for the flattened area to grow into while gently redirecting growth away from the prominent areas. The helmet doesn't squish the skull, it guides growth. Treatment typically lasts 3 to 6 months. While helmets are effective for reshaping the skull cosmetically, they don't reverse any airway or dental arch narrowing that may have already begun, which is why prevention is so much better than correction. Now, tell me in the comments, did your pediatrician ever mention any of this to you when your children or grandchildren were born? I'm curious how much variation there is in the information being given to families, because from what I've seen in my practice and in the families I consult with, this topic gets maybe 2 minutes of discussion during well baby visits, if it's mentioned at all. Here's the bottom line. Your grandchild's skull is malleable and responsive to environmental forces throughout the first year of life and beyond. The position they spend the majority of their time in will shape not just the appearance of their skull, but the internal architecture of their airway, the development of their jaws, the alignment of their teeth, and even their breathing patterns and sleep quality for years to come. You have the power to influence all of this through simple, consistent positioning strategies that cost nothing and take only a few extra minutes of attention each day. Rotate their head position during sleep. Maximize tummy time and side-lying time when they're awake. Minimize time in containers. Alternate which arm you use for feeding. Feel their skull regularly and watch for asymmetry. These actions seem small, but their cumulative effect is enormous. You're not just preventing a flat spot on the head. You're optimizing the growth of your grandchild's facial skeleton, airway, and brain. You're setting them up for a lifetime of better breathing, better sleep, better focus, and better health. If you take only one thing away from this, let it be this. Back to sleep is correct for safety, but the head must be repositioned regularly to prevent the developmental cascade I've described. Don't assume the pediatrician will tell you everything you need to know about this. Most pediatricians are excellent at managing illness and monitoring growth, but developmental positioning is often not emphasized in their training. It falls to you, the grandparent who's invested in your grandchild's long-term well-being, to implement these strategies. And if you're caring for your grandchild regularly, or if your adult children are asking for your advice, share this information with them. Help them understand that the first year of life is a window of opportunity that closes quickly. Once the skull bones fuse and the craniofacial structure is set, correcting problems becomes exponentially more difficult and expensive. I've watched thousands of children grow up over my career, and I can often predict which ones will need braces, which ones will snore, and which ones will struggle with focus and attention just by looking at the shape of their face and skull. The children with broad faces, well-defined jaws, and symmetrical skulls almost always have fewer health problems. The children with narrow faces, recessed jaws, and asymmetrical or flattened skulls almost always have more. This isn't genetics, this is environment, and you can control the environment. Start tonight. Check how your grandchild is positioned right now. Make one change, then make another tomorrow. Small actions, repeated consistently, create dramatic results. Your grandchild is depending on you to give them the best start possible. And now you know how. Click on one of the cards on your screen to watch similar content.